Presiding Officer, yesterday the Institute for Fiscal Studies published a devastating report on the state of Scotland's NHS under the SNP. They said, and I quote, "Performance in the Scottish NHS remains below pre-pandemic levels across many measures. Even more concerningly, many measures of performance have continued to worsen over the last year." Most damningly, they point out that although the NHS in Scotland has proportionally higher spending and more staff, recovery in Scotland's health service is lagging behind the NHS in England on every measure. So does John Swinney accept that SNP incompetence and mismanagement is bad for Scotland's health?
First Minister.
Presiding Officer, the National Health Service in Scotland relies upon the commitment and the contribution of thousands and thousands of members of staff, the length and breadth of the country, and I want to record my thanks to them for the work that they put in to ensure that we are well cared for in the National Health Service. The NHS is recovering from the COVID pandemic and we are making progress in that respect. We know that there is more work that has got to be done, but we have seen improvements in the latest quarter for information that is available, with reductions to the size of the waiting list seen in both diagnostics and inpatient and day case activity, as well as an improvement in cancer performance into the bargain. So I accept that there is work that remains to be done to improve the performance of the National Health Service, but the Government is putting the investment and the focus in to enable that to be the case.
Sarwar.
Presiding Officer, it's not just patients being failed, it's staff being failed, so they will not take kindly to be used as human shields in the SNP government's defence. Because John Swinney can try and spin the facts all he likes, but the devastating incompetence of the SNP is clear to see. And towards the end, he was focusing on inputs. Actually, this government needs to focus on outcomes. Because on Tuesday, it was revealed that the number of patients stuck on an NHS waiting list for over a year has now risen to more than 100,000. And there are now more than 863,000 patients on an NHS waiting list. That's equivalent to 1 in 6 Scots. And at the same time, we're carrying out 50,000 fewer operations compared to pre-pandemic levels, and delayed discharge has soared. So when will John Swinney stop defending the indefensible, admit that his SNP government has failed, and change direction?
First Minister.
I think what members of the workforce in the National Health Service will welcome is the investment this government has made to ensure that NHS staffing is up by 26% in the period between when this government came to office and where we stand now. And on specific examples, in cancer care, for example, the consultant oncologist workforce has increased by 50.4% over the last 10 years. So the government is investing in our NHS staff, and into the bargain we're putting in place pay settlements which have meant that we have not had to suffer and endure industrial action within the National Health Service in Scotland. Now, I would point out to Mr Sarwar that the number of patient waits for one of the 8 key diagnostic tests at the end of September showed a decrease of 7.4%. And we also saw in the most recent data that 73.2% of patients were treated on time within the 62-day cancer waiting times, which is higher than it was in the previous quarter. So what I would say to Mr Sarwar is I'm the first to acknowledge that we have challenges in recovering from the COVID pandemic, but the government is making the investment and making the interventions to ensure that our National Health Service performs in a fashion that meets the needs of the people of Scotland.
Sarwar.
That answer again demonstrates that the First Minister has his head in the sand. The IFS make the point. We have disproportionately higher spending here in Scotland, and we have more staff, but we have poorer performance. That points to not staff being wrong, not resources being wrong, but a failure of leadership and a failure of government. Because the uncomfortable reality for John Swinney is that no public service in Scotland is safe from SNP incompetence. On his watch, our NHS has plunged into a doom loop of soaring waiting lists and poorer health outcomes. Our schools, once the envy of the world, have seen collapsing standards and rising violence. Our prisons left in tatters, with prisoners being let out early because of mismanagement of our criminal justice system, and our housing sector in disarray with soaring homelessness and spiralling rents. The fact is that after 17 years of the SNP, every institution in Scotland is weaker. So can I ask John Swinney, how many people have to lose their lives? How many patients have to go private? How many people have to be trapped in hospital? And how many staff have to be pushed to breaking point before he accepts that he and his government has failed and that Scotland needs a new direction?
First Minister.
Presiding Officer, on a whole range of different elements of policy, the Government is delivering the progress that people in Scotland require. In the face of 14 years of austerity from the Conservative Government on housing, this Government has built more affordable houses per head of population than in England or Wales and in the period when the Labour Party were in government in Scotland, in the face of Tory austerity from London. Now, if Mr Sarwar believes that the solution to all of our problems in Scotland is the election of a Labour government, I would ask him to go and have a conversation with pensioners in Scotland today. Because in the first few months of a Labour government, pensioners in this country have been betrayed by the Labour government, who promised change, and all they did was slash the financial support for pensioners in our country by cutting the winter fuel payments. If that's what change means, Scotland doesn't need change, it needs progress under an SNP government.